Hey health warriors, preventing fraud and abuse in healthcare is crucial. In healthcare, doing the right thing isn't just about patient care, it's also about how care is billed and referred. Today, we're breaking down two key laws every provider should know, the Stark Law and the Anti-Kickback Statute, and how avoiding these legal pitfalls protects both your license and your organization. Understanding healthcare fraud and abuse is vital for maintaining integrity in the healthcare system. Fraudulent activities can lead to severe consequences, including legal actions and loss of trust. Healthcare fraud is the intentional deception for financial gain. Think, billing for services not provided or falsifying records. Abuse refers to practices that may not be fraudulent but result in unnecessary costs like overuse of services, improper coding, or questionable referrals. Combined, fraud and abuse cost the United States tens of billions every year, and they're monitored closely by CMS, the Office of Inspector General, and the Department of Justice. Now let's dive into the differences between the Stark Law and the Anti-Kickback Statute. The Stark Law prohibits physician referrals for certain health services payable by Medicare if the physician has a financial relationship with the entity. On the other hand, the Anti-Kickback Statute is a criminal law that prohibits the exchange of anything of value to induce or reward referrals of federal healthcare program business. Both laws aim to prevent conflicts of interest and ensure that patient care decisions are based on the best interests of the patient. The Stark Law, also known as the Physician Self-Referral Law, prohibits physicians from referring patients to a medical facility in which they or an immediate family member have a financial interest, for certain designated health services like labs, imaging, and therapy. This law applies even if there is no intent to defraud. Violations can result in denied payments, fines, or even exclusion from Medicare and Medicaid. The Anti-Kickback Statute, often referred to as AKS, prohibits offering, paying, soliciting, or receiving anything of value to induce referrals or generate business reimbursed by federal healthcare programs. This statute covers physicians, hospitals, marketers, and vendors. It's a criminal statute, meaning violations can lead to fines, jail time, and exclusion from federal healthcare programs. Both laws aim to keep care based on need, not on profit. Fraud investigations and compliance are crucial aspects of maintaining integrity within the healthcare system. How fraud investigations happen. Data analysis flags unusual billing patterns. Whistleblowers report suspicious practices under the False Claims Act. Audits and subpoenas gather documentation and interview staff. The OIG or DOJ may issue civil monetary penalties or press criminal charges. How providers stay compliant. Avoid financial relationships that influence referrals. Ensure fair market value for leases, contracts, or services. Keep detailed documentation for every referral, service, and payment. Train staff on compliance policies and reporting procedures. Conduct internal audits and seek legal review when unsure. Use caution with gifts, incentives, and free services, even for good intentions. As we wrap up, remember that staying informed and vigilant is key to maintaining integrity in healthcare. Fraud and abuse can derail careers and damage patient trust, but with the right knowledge and policies, we can deliver care that's not just compassionate but compliant. Does your team include fraud awareness in your annual training? Drop your best tips in the comments, like, subscribe, and follow for more healthcare compliance tools that protect your practice and your patients. And remember, do the right thing the right way every time.